Hi there, it's Dr. Scott Glocke. I'm an upper cervical chiropractor here in Yarmouth, Maine. And I want to do a quick tip of the week about some questions that we've been hearing over the last couple days. And that's one of the concepts of arthritis. We have a lot of patients that come into our office looking for help with different types of neck pain, back pain, stuff like that. But they also mentioned that their doctor told them that the pain was coming from arthritis and that there's really nothing you can do about it because arthritis is always there, and I am 50 years old and it's just something I have to live with. And I wanted to kind of show the spinal bones are kind of cool. Within the spine has these little curves. So we have a curve going forward in the neck, a backward curve in the mid-back, and a forward curve in the low back. This is designed as a cushion mechanism within the spine because the head weighs about the weight of the bowling ball. It weighs about 15 pounds, 10 to 15 pounds, give or take. Now your body has a reflex within the system called the righting reflex. The righting reflex is your body will do whatever it has to do to keep the eyes level with the horizon. That is because we need to see if there's something going to hurt us coming in our way. The saber-toothed tiger or crocodile back in the beginning of time, or that person who is in your blind spot looking to possibly run into you while you're driving your car. So that survival mechanism is very, very important. So your body will literally change and adapt whatever it has to do within the spine to keep the eyes level. That righting reflex is controlled by the spinal sensors within the upper neck area. So if the upper neck area is misaligned, it's going to cause distortions of posture and distortions of that information going into the brain. When you change the dynamics of the spine, you stress the spine in different ways. When the bones are stressed, they start to form bone spurs. So normally we want to see that spinal bones have a nice thick disc with a nice hole where the nerve comes out. This is designed for function, movement, also protection, and a lot of other particular things. But when the spine misaligns, it locks. When it locks, it doesn't allow for nutrients to get to the disc and to the nerve, and also the spinal cord too. But when it locks, it causes a lot of waste products to be accumulated and it doesn't function very well. So all of a sudden, added stress within the spine ends up creating bone spurs. So bone spurs take years to show up. The textbooks, especially with this amount of damage, at least 20 to 40 years for something like this to show up. But with the advent of a lot of computers and technology like phones, we're seeing this type of damage early on in early adolescent because of everyone looking downwards. And that is a problem within the spine. When you look downwards, you add more stress onto the spine. So the ways to prevent this from happening is to keep that spinal functioning movable, keep it properly healthy, also extension exercises, rehab to get that area functioning better, to get those muscles and ligaments and everything functioning as best as it can. But the major cause of why you're seeing changes within the spine, it has nothing to do with age, it has to do with balance of that righting reflex, balance of the spine and nerve system. So if you do have questions, you can always call our office or want to schedule a complimentary consultation. We're at 846-5100. I look forward to talking to you next time. Thank you.